As a physical therapist, you know that cardiovascular fitness is an essential component of overall health and wellness. But how do you measure your patient's aerobic fitness and endurance? The 2-minute step test is a low-impact exercise that measures how quickly your patient's heart rate returns to normal after a brief exercise period. To perform the test, have your patient step up and down onto a bench for 2 minutes at a pace of 24 steps per minute. After the 2 minutes are up, have them immediately sit down and measure their heart rate for 1 minute. You can use a heart rate monitor or count their pulse manually. Based on how quick their heart rate returns to normal, you can determine their fitness level using the chart provided. This information can help you tailor their exercise program to meet their specific needs and goals. If their heart rate recovery time is less than 15 seconds, their fitness level is considered excellent. 15 to 30 seconds recovery time is considered good. 30 to 45 seconds is considered average, 45 to 60 is poor, and more than 60 seconds is considered very poor. The 2-minute step test is excellent for tracking your patient's progress. By performing the test regularly and comparing their results, you can see how their aerobic fitness is improving. In our Carepatron 2-minute step test worksheet, there is a table to fill out the client's progress. You can also use the test to motivate your patients and show them how far they've come in their fitness journey. To find our 2-minute step test, go to our Carepatron platform. In our template section, we have a variety of templates and worksheets to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended